in order to show a little bit more detail how Ayurveda would look at this, I just thought to mention chronic fatigue syndrome. This is a condition which, 30 years ago wasn't even described. Patients who suffered it were regarded even as malingering because there was no medical thing that could be found wrong with them. Eventually, perhaps, it's now called post-viral fatigue because at least in some instances it's follows a viral infection or evidence of there having been a viral infection. But it's just a state of absolute depletion. It's very interesting because it was described in Ayurveda thousands of years ago. And it is a lack of ojas, ojas shaya, where the ojas is not strong. And then there is this lack of strength, lack of vitality, and lack of immunity, prone to all sorts of infections. So Ayurveda would say it's caused by an imbalance of Vata Pitta Kapha. It's caused by inappropriate digestion, disturbed digestion, or inappropriate foods, nourishment, eating rubbish, convenience meals, or lack the vitality, lack that propensity that could give us ojas. Acute stress is very disturbing to ojas as well, psychological problems, or imbalanced digestion is very fundamental for ojas. It's interesting then, the ama, if it goes to the rasa tissue, the first of the 7 metabolisms, if it's there, we get fever, we get enlarged lymph nodes, sore throat, muscle weakness, general fatigue. We've had a little bit of this when we've had a flu, some ama, some toxins going on that level. If it goes deeper, it starts to cause paleness, tiredness, anemia, hepatitis when it hits the blood tissues. When it hits the muscles, there are muscle aches and pains, headaches, insomnia. When it gets deeper into the fat tissues, we get intolerant of fats. When it goes deeper, the toxins go into the bones, joint pains, and then into the bone marrow, we can have neurological symptoms even. And at the deepest level, we get sexual disability. So Ayurveda would diagnose the person first, then the disease. The disease in terms of the dosha was the Vata Pitta Kapha, and which tissue was it? Was it the blood, was it the muscle, was it the fat? And which metabolism was it? Was it the ones in the liver, was it the ones in the tissues? And what were the causative factors in life? What was the person doing that caused this? These are all different levels of diagnosis. And then finally, Ayurveda would have to diagnose the strength of the patient and the strength of the disease. Because you have to give a treatment that the patient can tolerate, that's strong enough to tolerate, but is also strong enough to handle the disease. So, even the symptoms could go into the different types of Vata and Pitta and Kapha. For example, there's 5 Pittas, one of them is in the eye. So if the toxins are going to the eyes, you may get photophobia, the light may disturb your eyes. If it's going to Sadhika Pitta, Sadhika is located in the heart. It processes our feelings. So if Sadhika Pitta is getting clouded with we get confused, we get difficulty concentrating, we get forgetful, we get irritable. So like that, Ayurveda is making its diagnosis, and then it will do the treatments. So first of all, detox. And maybe the Panchakarma might be too strong for someone with something like chronic fatigue. And then Ayurveda would actually use gentler treatments, like the sipping of the hot water and just the dating lightly, or the spices for the digestion, or a little bit of exercise wherever they're able, or the use of sunlight as a treatment. Ayurveda would see that as very helpful. Or pranayama, breathing exercise, or meditation. These are all different strategies. But according to the patient, one might need to reduce exercise and get sunlight and take a light diet, stimulate digestion. Another might need to increase exercise, do pranayama and keep out of the sun. It depends on what's going on for the patient as to what the treatment strategies are to be. But you're targeting the dosha, you're targeting the metabolism, you're targeting the tissue, and you're even using herbs for all different herbs, combining them for all those. In Maharishi Ayurveda, there's a herb for energy, and a rasayan for energy, specifically to have herbs which addresses the metabolisms of the tissues like that. There's also a rasayan for ladies, which is a good tonic. And for men, MA631, they're signing for men, they would be Maharishi Ayurvedic products for energy. So I'd like then to start thinking about our fourth modality, because we've talked about Vata Pitta Kapha, we've talked about sleep, we've talked about the importance of digestion and metabolism, even in such chronic conditions as chronic fatigue. I suppose I should say, if you have had a recent great depletion in your energies, don't be shy about getting medically investigated. You should always seek a medical diagnosis if you have a significant change in your health. However, when you have the diagnosis, I think always it's worthwhile seeing if there are any natural approaches like Maharishi Ayurveda that you might use that could replace at least some of the medicines, you know? So, but always get your diagnosis and know what you're dealing with. Because, you know, when you're talking about loss of energy, it could be a chronic thing going on a long time, or it could be a sudden thing due to some other serious condition, and you shouldn't ignore sudden changes like that. Yeah.